Good morning and welcome to the Living with Rare Diseases Challenges and Opportunities webinar. I'm your moderator and my name is Farah. I am the founder of the Farah Foundation, whose vision is a conducive world with equal participation where warriors live with dignity, ability, and independence. I am also an advocate for positivity, self-love, and inner strength. I'm a writer, digital creator, and speaker who promotes positive personal growth through self-appreciation and acceptance. I'm thrilled to be joined by our expert panelists today, who will be sharing their insights and experiences with us. We've got a fantastic lineup, and I'm sure you'll enjoy hearing from each of them. So let's get started. A quick housekeeping reminder, please ensure your video is on the whole time and your mic is turned off for minimum disruptions. So we'll go with the introductions first. I'll just want you to briefly introduce yourself and tell us a little bit about yourself and the organization that you're representing. So we'll start with Dr. Karekezi. I'll give you the mic now.
So good morning and thank you very much, Farah. Thank you for inviting me to this forum. By way of introduction, Catherine Karekezi, pharmacist by training with a PhD specialization in medicinal chemistry. I have worked in research academia and I have done some work in drug regulation, but currently I am the executive director at the NCD Alliance of Kenya, which is a non-governmental organization which basically works in the area of NCDs, and we are an umbrella organization of different organizations working in the area of non-communicable diseases. So thank you very much for the invitation. I look forward to the forum. Thanks, Farah.
Thank you, Dr. Karekezi. It's a pleasure to have you with us today. And always NCDA holds a special place in our hearts as of our foundation. Let's go to Christine Mutena. I'll give you the mic now.
Thank you, Farah. Christine Mutena is my name. I am a mom to 2 kids with different rare diseases. I am also co-founder of Rare Disorders Kenya, which is a patient-led organization that creates awareness and advocates for people living with rare diseases in the country. Happy to be here.
Awesome. It is a pleasure to have you as well, Christine. I remember I met you once here at the Raza, and it was really a pleasure to meet you. You're an awesome person. And I really love your tweets on Twitter, by the way, guys. You need to follow her on Twitter. I will share her link. She's amazing. She's really inspiring, and especially with her journey with her kids. Alhamdulillah, it's really, really empowering us all. Next, we have Najda Khan. I'll let you have the mic now.
Good morning, ladies. Thank you so much, Farah, for having me. I feel so privileged to be amongst, such strong women in this, leading this topic. So my name is Najda Khan. I'm a strategic human resource professional by profession. I'm also the strategic planning director at the Farah Foundation. So, I was with Farah when we were launching it and now setting it up. And one of the reasons is because I personally have lived with the chronic conditions, quite a few, and chronic pain is the backdrop of my life story. But 2 of those conditions are considered rare, and that's why I think I'm going to be lending my voice in today's session. And I can't wait to get into it and to, spread the awareness and do as much as we can within our powers to get it out there. Thanks again for having me.
Thank you so much, Najda. And you're right, we have to do everything we can to get much needed awareness and advocacy. All right, ladies, so let's jump right in. I'll start with you, Najda. Please share with us your rare disease and the symptoms that you have.
Okay, so well, I'm living with for the last 5 years since my diagnosis. The diagnosis was 5 years ago, but it happens that it is something that I had been suffering for 3 decades. Just it went misdiagnosed in Kenya for that long before it got so severe that I had to fly out of the country and get medical care somewhere else. So this is interstitial cystitis. It's a chronic pain condition, but it's classed as very rare. And I mean, it's essentially a condition of the bladder. It's painful bladder syndrome or idiopathic bladder. It has various names, but basically it's when the bladder, in the most layman terms I can put it, loses its integrity. For example, in my case, let's go with my case. So this is where I was in severe pain. I couldn't urinate, but I had to urinate maybe up to 30 times a day, 10, 20 times a night alone. It was crazy. And the pain was so bad that I was crippled and I remember living on my sofa set for 3 months, with the bucket near me, not even lying down, just sitting there. I'd sleep or pass out or just get up from the pain. And it was quite a hectic journey from the pain, from the misdiagnosis, from the mistreatment I received at various hospitals with the senior specialists, and the lack of, I don't know why Kenyan doctors just generally don't like to give painkillers when people are really in pain. So I was a victim of one of that. It's a trauma topic for me. But so yeah, interstitial cystitis is just basically painful bladder syndrome. Just think of it in that way. You talk about Hannah's ulcers, you get a lot of ulcers within the bladder, losing a lot of the lining of the bladder. This causes a lot of infection. So you have continuous inflammation, continuous infection. The pain is severe. When I just had met all the possible urologists in Kenya, the senior ones everywhere in all the hospitals, and they said, okay, we don't know what to do. Some even told me, maybe Najda, you're exaggerating your pain. Like, we don't know what to do. There's nothing more we can do than this. I'm currently resistant to so many antibiotics because that was my life, for 30 plus years. My boss said, you know what, let's just take you to Egypt, because I work for an Egyptian company. Let's just take you to Egypt because you can't suffer this way. You can't be as you are. Let's just try our luck. What can we lose? So we thought, okay, fine. And in 2 days, we had a diagnosis, and we had all the urodynamics and everything done, and everything was confirmed. This is the situation. Here, they were saying you have chronic UTI. There, they said, no, your urinary tract is fine. It's perfect, actually. Your issue is your bladder. And this situation is not so severe if it's found out early, but your bladder has taken a beating for 30 plus years. So now we're calling it, like stage 4. It's really bad. So that's one. I could talk and talk and talk about it, but in interest of time. The other one is pretty recent. Again, something I've been suffering for many years is a lot of migraines that are induced by bright lights or flashing lights and blurry vision. So this gradually has gotten very much worse in the last 5 years, I would say. So after 30, as I was going on. And in October, I woke up one morning after a horrible pain the night before. And I woke up the morning and I was paralyzed, my entire left side. I had no use of my leg, my arm, my face, my eye wouldn't shut, my face wouldn't lift, like it was just paralyzed. So we rushed to the hospital immediately. Of course, the first form of treatment was she's had a stroke, pump me with aspirins, take all the scans, find out where that clot is. But eventually, when they didn't find the clot, I had a neurologist on my team of doctors, and he said, okay, I'm looking at this from a neurological, and they did all the tests possible, and they found out, okay, it's what is called Idiopathic Intracranial Hypertension. So IIH affects at least 2 in every 100,000 people, so it is considered rare, another rare disease or condition. And what happens is I tend to lose or get extremely minimum vision. extremely blurry vision. It happens mostly in the night. I will be able to see more with my left eye than my right eye. Obviously, they found that the optical nerve in the right eye is the one that's swollen, so this is why. The symptoms are just a lot of pain in the neck and shoulders. In IIH, essentially is when, again, in the most layman possible terms, when you have excess liquid in the brain and spine. So idiopathic intracranial hypertension. So it's not an inflammation problem. It's not a high blood pressure problem. It's just a lot of liquid, and this is causing strain. Of course, it's, you know, when you have a lot of liquid in the brain, so it can cause brain lesions, it can cause blindness, it mimics brain tumor without, of course, the brain tumor. So you have all the signs of somebody suffering with a brain tumor, but you don't actually have the brain tumor itself. Both of these conditions are chronic in terms of pain, in terms of the excessive, how they excessively reduce the quality of life and excessively change your lifestyle as well. From food to the things you can do to being outdoors. Most of these symptoms are not just the conditions themselves, but a bucket load of symptoms that come up from the medication you need to take for this symptom. Like, I feel we focus so much on the symptoms of the condition, but you know, when you're taking those medications for long periods of time, the symptoms of the conditions are not even on your radar anymore. Now you're dealing with symptoms of medications that we were given to cure the first symptoms, and those are really severe. They can be very severe. The current medication I'm on, I mean, I can't be out in the sun more than 10 minutes, for example, without, I used to burn as it is. Now I'm even more sensitive. Any access to sun, like you can't imagine, it's like I blister and the pain and my skin all over, it's crazy. So those kind of things, plus the lethargy, the tiredness, not being able to drive like I once used to, because, you know, some of these medications kind of mentally mess with your head. So driving or, you know, operating heavy machinery. And for someone like me, in my profession, that means a lot of meetings and a lot of engagement with people and serious engagement with people. You know, you're conducting onboarding or exiting staff, and these are serious things, and you have to be 100% there. But you're not only because there's a mental strain because you're thinking my finances, my life, my marriage, my everything, but the medicine's also messing with your head as well. So just in a nutshell, and like I said, in the interest of time, this is what the both conditions are, this is what they do, and this is what I have. This is what I have in terms of what is considered rare.
Right.
If we're going to go into this is what I have, then that's a whole other conversation.
You're right. So IIH and IC, those are rare diseases. I remember when Najda first told me about them, I was like, I thought scleroderma was hard to pronounce, but I was like, I'm not even going to try and pronounce that because, oh my God, yeah. I myself live with the scleroderma. I just want to briefly mention that and share. Scleroderma is an autoimmune disorder. It's in easier terms, sclero means hard and derma means skin. So it's a hard skin disease. It affects the biggest organ in our body, which is the skin. There's a lot of collagen that is being produced in my body, and that collagen goes and sits right under my skin. Now, what does collagen do is it's tightening my skin. It makes it hard, stiff. Do you know what they use to make you look younger? Botox. So essentially, my body is producing Botox for free. You know, I always tell you that I have lots of Botox. You know, but yeah, I've lived with it for now, I think 17 years. It has really reduced my mobility. It has disfigured my hands. I am partly differently able now. My face has changed. It has changed every area of my life you can think of. I have grown to love myself in a different way. I've grown to learn how to do everyday things in a different way. I learned to embrace it, accept it, and live with it, which is not an easy thing. I'm sure you all understand it's really not. And then the mental, emotional toll is on another level. But here we are, and I really want to spread awareness about these challenges and the opportunities that we have, because I don't want someone who is diagnosed today to feel lonely the way myself and Najda have felt. You know, in our symptoms, in our confusion, in our journey to find out what exactly we had. There was a lot of loneliness in that journey. Although our family was with us, but still, the fear of not understanding why your body is going through this, why is it happening to you, the lack of understanding from professionals, doctors, it's a lot, and I don't want someone to go through that. That's why we're studying awareness, and that we can at least alleviate some of that burden. Next, I'd love to speak to our able guests today, and please share with us, how has your organization been working to support people with rare diseases? We'll start with Christine Mutena. Please share. I'll give you the mic now.
Okay, thank you. Rare Disorders Kenya, or RDK as we like to call it, actually started as an awareness day campaign. We used to do rare disease every February, which is the last day of the month. Sorry. And with time, we realized there's so much more that we need to do. There's so much awareness, there's so much policy, there's so much lobbying we need to do. Give me a minute. Sorry. So you can get to the grassroots levels. And we formed the organization in 2018 so as to make sure that everyone living with a rare disease in the country can get some, worst case scenario, feel like they're not the only one. Because there's nothing as bad as going through something and not knowing what else, who else is going through. You don't have anyone you can reach out to and say, me too. Something as basic as that. And as I said earlier, I'm a parent of 2 kids with different rare conditions, and up to now, I've never found anyone else in the country with the same conditions. So I really understand when it comes to not knowing who else you can reach out to. But as a community, as long as you're both on the same journey, it's easier to walk that journey because at least there's somebody else to hold your hand. And for us, being a patient-led organization, our objective is to make sure that no one feels alone, because at the end of the day, we are a community. Yeah.
Thank you so much, Christine. I feel you. I totally feel you. And Najda is living with one such condition, and she's literally having communities from abroad. There's literally no one, and she told me, Farah, we need to talk about this here. There's no one here in our country, and I think there must be,
Actually, both the conditions. I've had to source support systems from, join groups on Facebook in the UK, in the US, but there's nothing here. I've tried to do it on Facebook, tried to reach out to people. I think it's also partly the stigma. If you're talking about, for example, the bladder condition, it's urine. It means not being incontinent. So women especially would be like, I don't want to go and say that I can't hold my urine or I have a problem. So they tend not to talk about it. So maybe that's another issue. But yeah, it's both conditions.
Definitely, it is. It is the stigma as well. Let's head over to Dr. Catherine. Please share with us what about your organization and how it's been helping to support people with rare diseases.
Well, thank you very much, and thank you especially for sharing about your different conditions. I must admit, I've not come across. Okay, scleroderma I've heard of, but definitely not Najda's condition. So thank you for being willing to share and just to be vulnerable. I should, first of all, state outright that NCD Alliance of Kenya, even though we do focus on non-communicable disease, it's only when Christine and Rosalind approached us that we actually started considering rare disorders and diseases in Kenya. I believe maybe I can just give you a background about the NCD Alliance before I move on to talk about the rare diseases. So we are an umbrella body of different organizations working in the area of non-communicable diseases. And essentially when it was formed, this was in 2011. This was just before the first UN high-level meeting on non-communicable diseases. At that point in time, we were really focusing on the 4 major NCDs: diabetes, cardiovascular, cancer, and chronic respiratory diseases, which they've now since expanded to include mental health disorders. But essentially, rare diseases were not on the. So even as NCD Alliance was formed, the main focus was on those initial 4 conditions. And then, although in terms of Africa, we also looked at issues of violence and injuries and other neurological conditions, so issues of epilepsy were also included. We have since then expanded our membership, and once we started and the organization was formed, we do have, amongst our membership, we have professional associations like Kenya Cardiac Society. We have local and international NGOs. For example, we have Kenya Diabetes Management and Information Center. And then we have patient-led organizations. And this is where a lot of the other conditions, which were not the primary focus of WHO and globally, like Down syndrome and even dementia at that point was not a major focus. But now we do have these other organizations led by persons living with NCDs, which are now members of NCD Alliance. And this has helped us expand our area of focus. Because I remember upfront, a couple of years back, we had wanted to, we're doing like advocacy training, and we wanted to include membership from these other less recognized conditions. But our donors were very strict. They said, no, we're still sticking to the 4 primary NCDs, but we have tried as much as possible with the funding that we have received, where we have flexibility to include the other less known NCDs or conditions. But it's only until I met Christine and Rosalind that I knew about the Rare Disorders Kenya and the different types of conditions are included in that spectrum. So I must also admit, a lot of ignorance on my part in regard to some of these conditions, but we are now embracing the different NCDs. We do have membership like from lupus and all the other smaller, smaller in but big burden, and also difficult to manage, and more importantly, little priority. In terms of priority, little attention is focused on rare diseases. Understandable, yes, because of the numbers who are affected by the other so-called major NCDs. But we do recognize that irrespective of whichever condition you have, it's a chronic condition, it's a lifelong condition. You're going to live with it for 24 hours a day, 365 days a year, and you can't get away from it. So as far as NCD Alliance is concerned, we want to embrace all the different and see how best we can support persons living with these conditions. So thank you for the invitation, and thank you for enlightening me about the different conditions. I have read about some of them, but since they're rare, it's difficult to come across people with these conditions. But I think also something we need to recognize in our situation, there is the issue of stigma. And then there's the issue of, as Najda has also told us, difficulty in diagnosis. And you can imagine, I mean, we're here in Nairobi. Think about somebody up country in a rural setting, a lot of stigma, all the other myths and misconceptions about these conditions. I would imagine a lot of them may be considered witchcraft. So really, people don't have a choice, and they don't have options, and they don't have access. So there may be other people with this condition. It's just that we don't know. They're not known. And I would imagine a lot of them actually die because they don't get any help, in addition to the fact that they're going to be ostracized by the society. So really, when you consider the mental health challenges that persons living with these rare conditions face, I cannot imagine. I mean, it must be horrendous. And so as NCD Alliance, we'd like to see how best we can support and at least include you in the programs that we have, and also maybe partner with you to look for funding so that, we do have access with some of our donors, or approach other donors to see how best we can actually support these rare conditions. And at least now the Ministry of Health is recognizing the need to support. Of course, as you look at the economics of scale, it's difficult, but I think now the Department of NCDs is ready and willing to see how best to support. We do work closely with the Ministry of Health, and we do challenge them on some of these issues. And we recognize the way that they have embraced people living with NCDs. They are more open to engaging with them, involving them in policy decisions, making processes, and inviting them for meetings. And even the fact that there's now the rare diseases technical working, that is a big step in the right direction. So thank you very much. As I say, I'm fairly ignorant where rare diseases come from, but we look forward to working together. Thank you.
Thank you so much. NCDA has really made tremendous strides. And I'd really like to commend Christine as well for bringing rare diseases, her organization to life and taking it to NCDA and sharing about us. Yeah, we are in this together, and big hug to you, Christine. Yay! 3 cheers for you, and Catherine as well. So, ladies, what would you consider? What would you see as the gaps in advocacy? What would you consider as? Are there any challenges you face in advocacy at the moment, and how best can we work to mitigate these gaps and ensure that the voices of people with rare disease are heard? And as you mentioned, Catherine, people in grassroots levels, I cannot imagine the burden that they have. Medicines, doctors are just, out of the question for them. And someone like me, I just like to mention that even for my condition, witchcraft was first considered before we went to a doctor. So, it's a mindset thing. And I just want to start by sharing that I feel like we really need to work on mindset and how we can really challenge these perceptions about us. So I'll hand over the mic to you. I'll start with you, Catherine. Please share with us some of the gaps that you see in advocacy and how best can we work to mitigate them.
Thanks, Farah. I think one of the main gaps is awareness, lack of awareness in our communities. And as we've mentioned, the issues of perception. We do have, I think it's just normal that you come across something that you don't know. Then you try and explain it away using either your belief systems or your perceptions. And having these rare conditions, okay, I cannot imagine what you go because I'm not in your place, but I would imagine it's very difficult. And even for the communities in which you live just for them to come to that area of acceptance. But I believe the issue of awareness raising in our communities about these different conditions. Because if you consider like a child living with type 1 diabetes or a child with cancer, even the community reaction to that is difficult. Now, having a rare condition which most people do not know about can be 100 times worse. And yet we have been working in the communities trying to create awareness about NCDs. But there's still a long way to go in terms of creating this awareness and enabling people to understand that there are different conditions, and these are generally lifelong conditions, because most of our communities and what we have been exposed to in the past have been short-term infectious conditions, apart, of course, from HIV/AIDS. So people are, to say comfortable with malaria or comfortable with a respiratory condition, take antibiotics, 5 days, problem solved. For malaria, a couple of days, and the condition goes away. But these conditions which hang on, and I think the main issue is progressively get worse, because unless, of course, access to treatment, that is a different, it's really different from what people are used to. And this obviously causes a lot of the stigma that people have. So creating awareness about these conditions is an area which we need to focus on. And not just in the communities, but also with the policymakers. Because as rare conditions, most people would not have come across them. They all know about the diabetes, the hypertension, strokes, cancer. Well, not all about, but at least they have some idea. So now when you now bring in these conditions which have affect a very small proportion of the population, it's a different mindset. And yet we're still struggling with, if you look at now resource allocation, we are still not dealing with the diabetes, the cardiovascular, and all these so-called primary NCDs, which are the main focus of the government and the policymakers. And now we're bringing on board the rare diseases, which because of their rarity and because of the numbers involved are very expensive, I imagine, to manage. And yet we have a limited budget. At the moment at NCD Alliance, we're trying to advocate for prioritization of non-communicable diseases. We have focused, rightly so, on infectious conditions, maternal child health conditions for the last, many years. NCDs are now the leading cause of death in our countries, and even the leading burden in our countries, especially when you consider that persons living with HIV/AIDS are now dying from strokes, cardiovascular conditions, and complications of diabetes and hypertension, and so on. But yet, if you look at the resource allocation towards NCDs, is not commensurate with the burden of these conditions. These conditions cause at least 49% contribute about 49% of the deaths in our country. They are more than 55% of the hospital admissions. But in terms of resource allocation, be it financial or appropriately trained healthcare providers, it doesn't actually align with the burden of these conditions. So as NCD Alliance at the moment, we are trying to create awareness. We're also trying to advocate for prioritization of non-communicable diseases by the government in terms of UHC, in terms of national health insurance, in terms of the packages available for NCDs. Mainly NCDs, as you well know, are paid out of pocket by people with these conditions. Of course, we recognize that, yes, the government has now introduced packages for management of cancer, packages for management of renal, especially renal condition, renal dialysis. But we are trying to advocate for resource allocation across the board. Let us see how we can, one, support treatment and care for people living with different NCDs. And included in this would be the rare diseases, which we recognize are difficult to manage, they're expensive to manage, and even access is difficult in our setting. So I believe awareness, advocacy, and just really advocacy and also capacity building of healthcare providers to understand what these rare conditions are and how to manage them, and also capacity building of the individuals living with the different conditions to, one, better understand their condition, and two, capacity build them in terms of advocacy skills, which may not necessarily most people may not have the skills, the advocacy skills to be able to advocate for themselves, and also just to understand issues of policy. How can we advocate to the government to prioritize these conditions? We need to understand resource allocation. How does the government allocate resources? Things. And also be aware of the different cycles in terms of policy making. For example, the budget cycle. At the moment, they are actually now, they've already kind of formalized what is going to go into the budget for 2023-2024. So for us to understand at what point do we need to advocate to the government to ensure resource allocation for these conditions. So understand the budget cycle, understand issues of public participation, which is a right for every citizen. But by and large, the majority of us do not understand issues of public participation. We know it is there in the Constitution. We know we have a right to do it, but how do we do it? And when should we do it? So a lot of the times we are left behind in the process, and we start when the process has been finalized, and then it's difficult to make the changes. So these are some of the areas which NCD Alliance of Kenya is trying to address in terms of community awareness about different non-communicable diseases, capacity building of people living with conditions to better understand their conditions, to better understand what is available to them and how best they can manage their conditions. Also capacity building together with the Ministry of Health in terms of the healthcare providers, and also trying to strengthen, provide resources for managing these conditions, and also for people living with NCD and the general public to understand their role in policy making and how they can influence policy making and resource allocation so that there are resources to manage these conditions. So those are some of the areas I think that I've talked both. And also capacity building of people living with the different conditions in terms of advocacy skills. How do you advocate and how can you become an effective advocate for your condition using your lived experience? The power of the lived experience is something that most people don't understand or don't recognize, but really you are the best advocates for your conditions. I can stand up and talk about your condition, but you would speak to it from a different perspective, and you would definitely be more effective in terms of an advocate because you have the experience. So thank you very much, Farah.
Thank you so much, Dr. Catherine. You have mentioned some really important and crucial areas that are, that need to be addressed, and we need to hit them together. And I'm sure we can work together on this and really ensure the policies are in place. And I'm glad to see the progress that has been made by the government. and hearing this from you for the first time. So I feel like even communication is an issue, especially with our opponent. Then they just say it out loud. I feel like we don't the communication, yeah. But yes, I'm happy and glad there's some good news. There's progress, and it's amazing. Thank you so much for sharing those points. I'll head over to Christine. I'll let you have the mic now, please. Do you want me to repeat the question, though, right?
No, I think I got it. The gaps and challenges in advocacy, right? For us, we find the gap, one of the biggest gap is research or lack of it for that matter, in the sense that there's no data, there's no national definition, there's no national registry. So small things like that, as small as it may sound, is actually a huge factor in trying to create anything around rare disease in the country. Some of the challenges we have is stigma that I think Najda quite put it very clearly. Funding, in terms of what Dr. Karekezi was talking about, in the sense that no one wants to fund something that is not known. There's lack of treatment, because you only find that only 5% of the known rare diseases have treatment, in the sense that it's expensive to treat us, because you're treating a very small population. So there's no, and with treatment, it all comes down to money. So what money are they making by treating us? So there's that. Then there's also something as the unique challenges in Africa. It's different in the sense that our culture is different, our genome is different, basically Africa is different from the rest of the world. And a lot of these clinical trials have been done in the West, but they need to be done in Africa as well, for Africans, so we can get the correct, if I can put it in quotes, feedback or results for us Africans. Then there's also the lack of information by healthcare providers. You find that as people living with rare diseases, we tend to have a lot of information on our particular rare disease, but the healthcare providers cannot know all the 7,000 rare diseases. So that's why there's a lot of misdiagnosis and delayed diagnosis, because there's not so much information out there. So that doesn't help. It's easier if the doctor tells you, for example, this is cancer, you go and research on that particular cancer. But when you go back home and you tell your people the doctor doesn't know what I have, they'll be like, they already start judging and stigmatizing you, and doesn't help. So those are just a few of the gaps and challenges that we see to have faced in the course of this journey.
Thank you so much, Christine. You also mentioned a huge issue, which is the clinical trials and misinformation that healthcare providers. Oh my God. Only patients can understand this. I truly don't understand. But yeah, I feel like these are such huge issues. I'd like to hear from Najda as well. Najda, do you have something to share on any gaps in advocacy and how we can mitigate these areas?
I don't know. I mean, it's such a, for me, I feel like talking about advocacy, it's not redundant, it's extremely important, but how are we advocating for, from a patient's point of view? I'm speaking, not anything else. I'm talking about, we are advocating for, hey, rare diseases must be acknowledged. We need to know more. We need awareness. At the same time, we're saying doctors don't know many of these. There are no treatment options, at least not at the first try. In my case, for one of them, nobody could do anything. And even if they do diagnosis, in both my cases right now, we do not have the equipment or the expertise for pain management or treatment here in Kenya. So it's like a double-edged sword. We can't do one without the other. And we can't only focus on advocacy without, this. So I just feel maybe it's a multifaceted, multi-level kind of approach where we are lacking. Maybe that's the strategy that's lacking. I don't know. In more, I mean, apart from what's been explained today from both the organizations, I don't know if they're doing more on this or somebody else out there is. But I would imagine the strategy needs to have a two-pronged approach where doctors are being enabled. You're giving them enforcement. You're giving them training. You're, on rare diseases, on the importance of them, at least at divisional, at county level hospitals, or not just the big hospitals. At the end of the day, even me, I'm working, I'm earning a salary, I'm living what many will consider, with God's grace, a comfortable life. What about sorry, I don't know which of the ladies mentioned this, but what about the person in the slums? What about the person who doesn't even have that job or is living hand to mouth? How are they supposed to go, for example, to Aga Khan and pay 8,000 shillings to see a specialist, 3 times a month, for example? So it's sometimes I'm told, oh, but they are specialists, but you need to go to Nairobi Hospital or you need to go to Aga Khan. And it's all fun and games if you're just seeing them for one session. But then what if you're seeing them and that's not the case? The first session you see them is when they will tell you, go do the test, then you have to see them again, and then you have to see them again. So it piles up. So the multi-level approach and strategy needs to be from creating awareness with the people, everyone understanding, so that everyone knows what rare diseases are, what they look like, why they're important, so that we can identify them with our loved ones and our friends and our colleagues. But on the other side, what do we do once we've identified them if we don't have hospitals and doctors and treatment options in Kenya? So this is where I feel the gap is major for me. Like I said, 30 years of wrong misdiagnosis. So a doctor could have come up earlier and said, I don't know. Okay. But maybe it's ego. Maybe it's, listen, I'm a doctor. I can't say I don't know. Or no. This has got all this classical signs for UTI. That's all. That's what she has. I feel on a personal level, I just didn't get the oomph from a doctor. The doctors just didn't want to ask questions like, why? Why isn't this working? If this was a UTI, this medication should have worked. Why is Najda coming back to my office 20 years in a row? What's the problem here? There wasn't. It was pay my bill, 7,000 shillings. Here's the prescription. If that doesn't work, go for these injections once a day for X many times a day. And that was it. It was very dismissive, So I feel, and then only to find out what the situation is. And now because it's chronic, you were talking about Botox earlier. So my bladder needs to be pumped with Botox. And because Botox is absorbed in the body, it needs to be done every 6 months. There's a special needle that goes through the urethra into the bladder to inject the Botox, which helps it retain its integrity, its shape. It stops it from the spasming and helps it by giving that space so that at least it can be able to heal while we do that. So it's not available here. So that means what? Every 6 months, I have to find, I have one of two options. I have to find out how I will get tickets for me and my carer, hotel stay, hospital costs, a visa, COVID tests, and, time off work every 6 months to be able to travel to Cairo and then come back. And then once you come back, you have an infection from, the needle went in, it's an infection. So again, or there's, you get pneumonia like I did, when I came back from Cairo. So it's just, and that's another whole cost. It's not feasible. The other option is suck it in, live with the pain, give up on life as you know it, just hermit yourself like a crab, live in the darkest corner of your house and watch everyone around you just disappear because, the emotion is too hard to bear. These are the only two options we are telling people. And, we're not talking about people out there living. No, it's you, it's you, Farah, it's me. We have two people on this call. It's the two children, two children of, Lord, I'm so bad with names. It's her two kids. And so it's not a myth that, there's someone somewhere living with this disease that I read about on Facebook. No, In this call right now, there are 4 people already. It might be a rare disease, but it's becoming less rare to meet people because social media, because of such conversations, it's becoming less rare. So it's very difficult to live a life where those are your only 2 options, guys. I think without risking getting extremely emotional right now, this is what I want to say. So in terms of advocacy, I feel it's a 2-pronged approach, and this is what is missing, and we need to look at it in this way.
Definitely. Thank you so much, Najda. It's a multi-level approach. And yeah, I agree. I agree. That's Christine on
Yes.
my left. And up there is Catherine, understudying Najda.
I wanted to say something.
Sure, go ahead.
With a new breed of doctors that are coming in, it's heartwarming for us parents to hear that they are looking at the multidisciplinary approach that hasn't been there before. So there is hope. It may not be for our generation, but at least going forward, the new breed of doctors that are looking at multidisciplinary approach.
Yeah, because it's so true. When I was diagnosed with IIH, I had 5 doctors look at me at one go. This is something I only saw in Cairo. Every time I've been admitted in Cairo, I was never seen by one doctor. There was always multidisciplinary doctors. So there's a team. Everyone is looking at this case in this way, because they created a file where, okay, this patient has multiple issues. There's no way we're seeing her as one doctor. And they red flagged my file. So every time I went there was always a team like that. When I was admitted, and it was at Aga Khan this time, actually it was my first interaction with Aga Khan in this way, fairly recent, that they approached as a team. And there were like 5 doctors. And one thing that stood out, they were all within the same age group of probably mid-30s to 40. They were not old guys, that we're used to seeing. And they were all professionals or professors or associate professors in their own right, but they were young. They were in it. They said, no, this is a multidisciplinary case. You have to see the discharge summary that they wrote. I was so impressed at so many levels. So I'm so glad that you raised this. I don't think even I say it as much when I'm talking, but yes, there is a new breed of doctors. They are, you can feel it. I can feel it now, unfortunately, so many years later, but I can feel it now. So there is hope for, younger people to get maybe diagnosed earlier, but then it still has the issue of, is treatment available here? And the cost factor. Because when you talk about Aga Khan already, even when my husband took me there and that's where I was admitted, I was thinking, why did you bring me here? Like, this is one of the most expensive hospitals here in Nairobi, But that's still an issue. But it's so great that you raised this. I had to also say that this is something I realized, and it's once in my entire life in this country, which was great.
That's amazing. That's great news. Go ahead, Catherine. Go ahead.
If I can just speak to that point, I think we also need to recognize that there is a new approach to teaching medicine, where there's a bigger focus on the patient-centered approach. Before it was more disease-focused. But this is a movement, not just globally, I would say. And we are catching up here in Kenya, so that it's more about the individual, not about the condition. So that you're seen first as a human being who is living with a condition. It's not the condition which is living, the primary focus. So you find that this team approach, this multidisciplinary approach, is something which is slowly taking. But I believe even globally, if you look at the evolution of healthcare, previously, we're just treating you as a disease. And I know even when we were, just to give you a bit of background, one of the first things that NCD Alliance did was to develop the advocacy agenda of people living with NCDs. In order to do this, we had sessions with people living with different conditions. And one of the key criticisms they had of healthcare providers in our setting is the fact that you're referred to by your condition. You know, the lady with one breast, or the child, or the diabetic child, whatever it is, such that your condition is the one which is defining. And that was an issue that they all raised. All the people we interviewed, that was a primary thing that they raised. But since then, there has been a deliberate shift to have a more human-centered approach to healthcare, where you're looking at the patient as a holistic individual. And this is where now this multidisciplinary management comes in, so that doctors are now working groups, different specialities, to manage this specific individual. And even when I remember the genesis of the NCDAK Alliance of Kenya, this was a group of specialists, physicians, diabetologists, cancer specialists, cardiovascular specialists, neurologists, who came together and they actually realized, you know, we are treating the same person, but we're treating them separately. It's the same person who has diabetes, who has a high blood pressure, probably has had a stroke, is now living with dementia, and probably has cancer, or whatever condition it is. Why don't we come together and start this alliance where we look at people as individuals living with a condition, not looking at the condition primarily and then the individual. So this is a new, fairly recent evolution in terms of healthcare. And I'm glad that you've picked up on it, and the fact that people are now working in groups and having those consortium of different specialists managing one individual. And this is something we're hoping also be translated into the public health system. I know now, if, as you mentioned, in Najda Khan, in the private sector, they're more able to do this. But if you look at now our public health system, we're challenged in terms of the numbers of healthcare providers who are available, especially in different centers. So it may be a challenge, but I do know that there is a deliberate move to have this patient-centered care. And it's something that we know that needs to be expanded, needs to be improved, but at least there's that move towards that human-centered, patient-centered care, and having the patient at the center of the management, and for the patient or the person living in the condition to have a voice in terms of how their condition is managed. Here we need to have the empowered patient, as well as this multidisciplinary team of healthcare providers who would include not just the physicians, maybe a psychologist to help deal with the mental health issues, a sociologist or somebody from the social sector to look at now the social impact of this condition, a palliative care specialist to look at the issues of palliative care, pharmacists, laboratory technologists, everybody should be involved in that patient care. So this is a new move. I know it's something which is not widespread, but at least there is that deliberate to introduce this patient-centered care. And it's something that we as NCD Alliance are advocating for. It is something that we are challenging the Ministry of Health to, but of course we do also recognize the challenges that they face for whatever reason. But I know, for example, the Medical Practitioners and Dentists Council, this is definitely something that they're advocating for. So thank you very much for bringing it.
Great. That was amazing. Thank you so much for sharing that. It's good to know that there's a new approach now. I wonder if everything's okay with Catherine. Catherine, are you okay?
Yeah, sorry, there was something which was my light was going off and on, so I needed to.
I just saw the light and I'm like, I hope nothing is burning out.
I know that. Did I just see some light there?
Yeah.
Awesome.
Thanks.
All right. Thank you. Great.
Maybe if I can just add something else to what Christine said in terms of the data. and the lack of knowledge about
essentially
to do efficient or effective advocacy. That is something that is critical because you have to have evidence for what you're advocating for. So the fact that we don't have a national registry for rare diseases is a challenge. Not that it gives you any comfort, but most of the NCDs do not have national registry. So we do not have accurate data about the burden of NCD. I know we do have a cancer registry, and at the moment the ministry is working on terms of having a registry for diabetes and cardiovascular conditions. But most of the conditions we do not know, we do not have accurate data. But this is something which is the ministry recognizes, and they're actively looking to see how best to address these challenges. For example, sickle cell disease, which is endemic in certain parts of our country. I know there is beginnings. They are looking at working on registry, which has been started by physicians attached to Moi Teaching and Referral Hospital. But these are all like somebody has to start, and then it is then moved forward. So I'd encourage you to at least take a start. And with all the priorities and issues that the ministry is dealing with, let us see how we can start. And then at least we have the data, which will also help us support the advocacy. Should be done. I recognize also what Nadia said about advocating, creating awareness, and then what? Yes, it is, in a sense, there is an ethical issue with that. I mean, so fine, I know I have a rare condition. What do I do about it? Yeah, so that is a challenge also. Thank you.
Thank you so much, Catherine. Yeah, I think we should really look into that national registry and together as organizations, maybe we can all join hands and partner on this, and then build our own registry. And then now I guess it's upon us to get on with this. We are almost a bit over time. I just want us to quickly share a few resources on the spot available for people with rare diseases, and then we can just have 5 minutes just to share your perspectives on the broader impact and your ending remarks. So I'll start with you, Najda. Would you like to share some resources really quick? Let's hit time. All right.
So, I mean, I don't really have, like I said, resource was my biggest issue. So apart from the organizations on this group, but even then, I'm sure there's no specific resource within any organization on a specific disease. So what I found was Facebook, YouTube. These are huge resources. You just go in or Google search, just search your condition, add in keywords like support group or, group or something. And it gave me, for me, it brought up quite a few options on Facebook and YouTube videos of people living day-to-day lives and how they're getting along with it. The beauty about such groups is it really does tell you things that medics will really not be able to, I was mentioning to Farah once how, you can learn about a certain, for example, I learned from there about coconut water being extremely helpful for the bladder. I didn't even know, and it does. It really helps. Some people it doesn't, some people it helps. My second resource and my most important one is your body. Just kind of listen to your body. Your body will always tell you what you need. Sometimes I think if you call it intuition, call it, I don't know, a voice in your head, but listen to it. Keep it on the same frequency like you are. Listen to it like religiously. I mean, so I found this out because I just constantly felt like I needed to put a heating pad in my underwear so that I can have this, especially when I had a flare up, when my bladder was really bad. I just wanted heat or I wanted ice. There are times I wanted cold or hot. So I got one of those heating patches, the ones you put in the microwave or the ones you freeze. And I bought those really small ones. I remember they were ridiculous. I could only get them in China, and it took months for it to get here. But once it did, it has never left my handbag, because you can start feeling pain and throbbing and spasms, and you'll find a microwave anywhere, and then just slip it into your panties. Not the most comfortable, but the relief is amazing. No doctor told me this, no support group told me this. My body just said to me it wanted heat. I just felt it needed the heat, and it worked. So I think listen to your body. When you're tired, don't push yourself. When you're saying sleep and it's 11 o'clock in the morning, sleep. So these are my two most important resources, Farah, and I feel I think this is what is getting me through and continuing to get me through. And of course, speak about it. This is therapy for me, just being able to speak about it. By under no means should you disregard therapy. Please see a specialist, talk it out. The change in your life is going to have effects that are seen and unseen. And your mind is an extremely powerful tool, and it can take a toll on you. So please get some therapy. And most importantly, find a doctor or a specialist that you vibe with. I think this is very important. There needs to be a vibe. There needs to be an unspoken frequency between you two that you guys share. And this is very important, because this is an extremely personal, extremely critical part of your life. And if you don't have that connection with a specialist, it's very hard to feel acknowledged. So thanks, Farah.
Very valid and important points, Najda, and I'm with you on the doctor and speaking about it, because that has been my therapy as well. Sharing my story has literally given me the freedom. It gave me a voice. It gave me a purpose today. The Fire Foundation was a dream, and once I shared my story, I could see that this is going to be possible. And honestly, the strength that it has given me, it's unmatched. It really is. So yes, I would highly recommend. Talk about your condition. I know it's not easy for some people. I have spoken to people and they don't want to share. They feel shy. They're afraid. It's not easy, but through support, by seeing, I always tell myself, if someone sees me and they say, if Farah can do this, I can do it. And that is my personal motto. I want someone like me who is shy and who is afraid of herself the way I was, who is afraid to look into the mirror the way I was, who is confused and scared of her body the way I was. I want her to look at me and say, Farah is on Instagram, she's on social media, she's on TV. I can be there too. That's it. That is my motto for life now. I'll let Christine take the mic now. Christine.
Thanks, Farah. For me, my resource initially was for my kids was, as Najda said, Facebook groups, because they're global, and you get the tips and tricks and daily knickknacks that you cannot get from the medical fraternity. So for me, if we normally advise our members, if you want a local group, we're here. But if you want a disease-specific group, look for it mostly on Facebook. But look for it and they will give you the day-to-day tips and tricks. But we always want to have somebody you can see face-to-face. Somebody you can even meet for coffee or go for a walk somewhere. So you can at least, there's always something about physical support. So I will definitely say my biggest resource is Rare Disorders Kenya, in the sense that having somebody I can talk to, I can pick up the phone and call, I can go to their place and tell them I'm having a bad day, I'm having a good day, this is what I'm thinking. I can say I've gotten that from members of Rare Disorders Kenya. I'd like to plug our website, which is www.rarediseasekenya.org. Social media, we're at Rare Disease KE, regardless of the platform. And you can get us on 0701 025 753 for phone calls and text. WhatsApp, not quite monitored, so what's best is phone calls and texts. So you can reach out to us and we can direct you how we can move forward as an individual and as a group.
Awesome. Thank you so much, Christine. And thank you for plugging in that information. I will also add it in our description box and share it on our socials as well. That is so important, and I'm really glad to share that. Catherine, over to you now.
So thanks very much, Farah. I think the biggest resource is yourselves. The lived experience, as I said, is actually the biggest resource. And self-advocacy, yes. Just to mention that at NCD Alliance, we do have the National Caucus of Persons Living with NCDs. This is an organization, a grouping of organizations led by people living with NCDs, living with different conditions. I think, Christine, your members, and this was, the organizations are all members of NCD Alliance. This is a forum that they share where they're able to discuss issues regarding their conditions, advocacy issues that are needed. And this is actually a group which now recognized by the Ministry of Health. So they will invite them for various activities or policy processes. And I think that would be a good resource. And also the meaningful involvement of the Global Charter, which actually specifies what meaningful involvement of people living with NCDs is about. It has been endorsed by the Ministry of Health, and this is why they're actually now actively working with people living with different NCDs. And then I should also mention that when we were doing the survey right at the beginning of NCD Alliance, the people living with NCDs did state that they are the experts of their conditions. So as an individual living with the rare disorder, you are probably, apart of course from the technical aspects of Dr. in all the other issues of living with that condition, Nadia and mentioned, these groups, support groups that you find, will be able to give you daily tips that probably the doctor doesn't know. And I've found doctors these days are more willing to listen. And if you find something that is actually helping, they're more willing to listen and to support you, even as you try, the coconut water, whatever else it is. But as Nadia says, make sure that you do go back for reviews. Don't just go off on a tangent and listen to everybody that, everybody else is saying, but do keep track and do keep aligned with their doctor so that they are able to monitor, even as you maybe use alternative therapies, that they're not actually harming some of the other body systems, even as they're giving you relief in one area. So I think that's what I'd like to say. And just to recognize the fact that as persons living with a rare disorder, you are the experts of your condition. You have taken the time to learn about the condition. And in most cases, you're probably better informed than a lot of the doctors that we have in our country. And I believe now the doctors are becoming less threatened by the information that people living with different conditions have access to. And a lot of the doctors actually recognize that in some instances, you actually know more about, you definitely know more about living with a condition that they know. They may know more about how to treat it, but in terms of the day-to-day living, you are the experts of your condition. So as you have said, find a doctor who is willing to listen if you can, and who's willing to recognize the expertise that you bring to the management of your condition, because you're the one who lives with it 365 days a year. And at the end of the day, you're the expert. And that is something that the people living with NCD told me when I was doing the survey. We are the experts of our condition. We need to be recognized as experts of the conditions that we live with. We recognize the doctors are the ones who help us and guide us and give us the technical expertise to manage our condition. But at the end of the day, we are the ones who have to live with the condition. So let us take charge of our condition and let the condition not take charge of us. So we need to manage our condition. So thank you very much, Farah, Najda, and also Christine. I am learning. I don't know as much as you know, but I'm willing to learn. And we're willing to work and to assist where we can. And also just to mention the fact that the ministry is now recognizing the role of support groups. And they want to see how they can also learn support groups in terms of what they're doing and how they're helping people manage their conditions. And also, I think the only thing they're a bit wary with is support groups which go off on a tangent and where the people living with the conditions are no longer linked to the healthcare providers. That for them is a bit lack. But they're willing to listen and they're willing to support. So they are coming up with a support group framework, which hopefully would help the ministry maybe more involved in some ways. But at the end of the day, you are the experts of your condition. So thank you very much.
Thank you very much, Catherine. That was amazing. Let's take charge of our conditions and not let the condition take charge of us. She's absolutely right. And I am very, very happy today to hear about all the amazing progress that has been made, especially with the Ministry of Health. And I like I said in our newsletter, this year we're going to make noise and we are coming in by force and in full force. We are no longer going to remain unnoticed, and I am sure Najda and I are going to sit down and really think of how we can partner with both you, Christine, and NCDA, and let's take this. Let's just make the huzala and make noise all around this country. Thank you so much, ladies. We're nearing the end. I'm just going to give you all the mic. And yes, definitely. Christine wants to plug in something special that is going to happen on the 25th, and I want to hear her that time. So as we go around hearing our ending remarks, I just want to share that at the Farah Foundation, we have a newsletter that comes out every 2 months. It's called the Farah Foundation Updates. It's absolutely free. It's available on Substack. I'm going to share the link with you as well. The firefoundation.substack.com. I'll just put it in the chat as well. And then we also have we also have a WhatsApp community of warriors. These are people living with autoimmune and chronic diseases. We're a small group. We're still, making the noise and getting people to join us. What we do in the group is lots of support and encouragement, inspiration. We find ways to, charge ourselves each and every day, try to promote each other, empower each other, celebrate each other with the small wins that we had, every single day. That's us. If you want to join our WhatsApp community, DM us. Yes. Huh? Yeah, we also exchange resources. DM us on socials. We are at the Farah FDN on all social media, and we are going to send you the link to join us. All right, so I'll just hand over the mic to you guys now. Ending remarks, closing remarks, and yeah, take it over, guys. Whoever goes first.
If I can, ladies, I want to close with 2 parting shots. Is one to the world, I want to say that people living with rare diseases and chronic conditions or essentially life quality altering conditions face daily challenges and difficulties. These individuals often struggle with physical, emotional, financial burdens, as well as a lack of awareness and understanding from the general public. So, I mean, they also face limited access to treatment options and support resources like we've discussed. But despite these challenges, many people living with rare conditions and chronic conditions show remarkable strength and resilience. I think they're the most determined people I know. The people I've met with these conditions are trying to make the most out of their life. They're the most resilient people I know. So I feel like, though, maybe if I could say anything to you, if you wanted to know, hey, how do I behave around them, or what can I do, is just be yourself. Don't treat them differently, and by all means and all circumstances, never look at them like you're feeling sorry for them. This is speaking as a warrior myself, and on behalf of so many people I know who I've shared this conversation with. Don't do that. Take the time to understand how resilient they are. So if you have a platform and in your own way you can say something to raise an awareness, please do. And be kind to anyone you meet. You don't know what war they've been trying to win, and you don't know how many scars they carry as proof. So this is what I'd like to say to the world, and to you, to the warrior, to the beautiful soul that's listening to this, who's going through, who is rare in his or her own right. It doesn't define you, it doesn't control you, and it will not stop you. If you're down in the dumps, if you've hit rock bottom, we've all been there. Stay there, the bask in the sunlight, do your thing, but remember that it can't control you and it won't stop you. You can come out of it. The pain will not silence you. The suffering will not silence you, and eventually even that stigma will not silence you. You can raise your voice, you can use your strength, you can use your spirit, you can share your story and your journey to raise hope. You will definitely inspire, you will empower, and you will educate others. You're not alone, you are not invisible, you are not weak. You're a warrior, you're a fighter, you're a survivor, and that is who you are. Thanks.
I was just cheering. I was like, yes, say that again. All right, let's head on over to Christine. Take over the mic.
Thanks, Farah. Two things as well. The first is RDK is having an event on the 25th of February from 9:30 in the morning. It's a hybrid event, but we're encouraging guys to come physically so at least you can meet and catch up. It's going to be held at the Nairobi Hospital Amphitheatre. That's at the Conventional Center, Anderson. And it's a day to just be rare. Let me put it that way. Come and just be rare. So you're all invited. And second thing is, I'm glad to have been part of this panel. It's glad to have met you, Najda. And as you've said, the world is our oyster. Let's just continue advocating for those living with rare diseases in the country. Thank you.
Yay, we are invited. Thank you so much, Christine.
Of course, you're invited.
Thank you. We are going to be there. We're going to show up. And let me just remind you, pink, blue, green, or purple. These are the colors to wear this month to show support for Rare Disease Awareness Month. So I'm wearing pink today. That's my favorite color. And I'm going to rock it all month. I told my mom, I'm like, pink, I want pink. She's like, oh, okay. So yeah, wear all these shades, and I hope I'll see them at the event as well. Let's read the mic to Catherine.
Thanks, Farah. Thanks, Najda, and thanks, Christine. Thank you for inviting me, and also for opening up a little of your world to me. I know sometimes it's not always easy to do this, and we recognize that. But we thank you for being vulnerable and for being willing to share your life with us. And as I've said, you are the experts of the conditions that you live with. And we as NCD Alliance are here to support and are here to give you a platform and also to encourage you to continue speaking and to continue advocating for your conditions. If we can open the doors for you, we're more than willing to help you, to help open those doors. And we're ready and willing to work with you. And also just to continue advocating for people-centered care in our country to ensure that everybody, irrespective of where you live, has access to the healthcare that they need. And also, I think my parting shot is, even as you continue advocating for yourself, let us remember the common mwananchi, as Najda says, does not have access to this healthcare. How can we at least try and make sure that everybody has at least a basic access to healthcare that they need at a price that is at a cost which is affordable to them, and they're also able to access quality healthcare. So thank you very much. I shall continue learning from you, and I look forward to the next engagement. Thank you.
Thank you so much, Catherine, for those amazing parting shots. Christine, did you want to say something?
Yes, I was going to tell Dr. Karekezi the next event is on 25th. The next meeting, we're meeting.
Right. It's all, I just added it on my calendar as well. Najda, you have anything to share?
Yes, I wanted to say because this is being recorded to be played later, it has to be on record. It just says a lot that the four people in this call are all women, and I think it says a lot. That speaks volumes to me. That screams out, because one thing you learn, whether you have a disease or not, whether you have a condition or not, is women do take charge. Women are carers. Women, care, and it says a lot that the people on this call are all women. So I want to say that also, Farah. The mural behind you, where you've been sitting this whole session, has the pink flower has literally just been placed. It looks like it's been placed there on purpose. It's just made for an amazing backdrop throughout the call. Just to end on a lighter note, it looks amazing, by the way.
Thank you. I was like, I'm sitting right here and not moving from here. It was intentional.
It's a very beautiful background.
I was just trying to see if you could take a picture. Najda, do you know how to take a picture?
No, I'm just taking a screenshot.
Oh, yeah. How?
I tried to take a screenshot for you. If you can just pause for like a second.
Yeah, let's just take a picture.
But it doesn't show everyone.
It does. Let me take.
Let me take as well.
Is it showing all of us?
Yeah.
Whoever's okay.
Yes, it is.
Use a screenshot here.
Right. Okay.
Smile.
Guys. All right. Great. Got them. So I'll just to end, thank you so much for being here today, ladies. I am truly humbled. For me, it is to continue our work with the Farah Foundation to empower, voice, and advocate for people living with autoimmune and chronic conditions, which are also rare. And yeah, we're going to, I think we'll be working together now and try and bring the changes that we want to see. And as Dr. Catherine said, we are the experts of our condition. And like Christine and Najda said, we can do it. We can do the things that we want. Right. All right, ladies. That brings us to the end of today's webinar. Thank you so much. And yeah, let's keep chatting on socials.
Okay, and see you on the 25th.
Yes,
see you on the 25th.